Hey everyone, how's it going? My name is Keegan Allen, and I'm currently a chiropractic student at Park University in Dallas, Texas. I want to start by saying if this is your first time looking into chiropractic care, I'm glad that you're here. I remember the first time that I actually looked deep into chiropractic care, and whenever I had people explain to me what it actually was, it changed the way I thought about health. So that's what I'm going to try to do for you today, explain what chiropractic is, what it can do for you, and why it might be one of the best decisions you make for your body. So, getting into what is chiropractic, when most people hear the word chiropractic, they immediately think back pain, cracking backs, maybe something a little intimidating, and I get it, but that's what I thought at first too. But chiropractic is a lot more than that. At its core, chiropractic is a natural, hands on form of healthcare that focuses on the spine, the musculoskeletal system, your bones, joints, and muscles. But the part that really matters, your spine isn't just holding you upright, it's protecting your spinal cord, which is your body's main line of communication between your brain and every part of your body. Every organ, every muscle, every function, all of it runs through that system. So when your spine isn't moving the way it should, it's not just your back that feels it, it's your whole body that feels it. So explaining the adjustment. So the heart of what chiropractors do is something called the adjustment. And a lot of people are nervous about the adjustment before they experience it, but the adjustment is just a specific controlled force applied to a joint, usually in the spine to restore proper movement and alignment. When a joint gets stuck, restricted, or moves out of its normal position, we call that subluxation. A subluxation doesn't just cause pain locally, it can put pressure on your nerves, disrupt how your body communicates, and create problems that show up in places you wouldn't even connect to your spine. The adjustment corrects that. And to get the joint moving again, it takes the pressure off the nerve and gives your body the chance to do what it's already built to do, which is heal itself. Now, you might hear a popping sound during adjustment, and that's just gas being released from the joint. Completely harmless, and honestly, most patients find it satisfying, but not every adjustment makes a sound, but that doesn't make it any less effective. The benefits of chiropractic. So, a lot of people ask, what can chiropractic actually help with? The obvious ones are back pain, neck pain, and headaches, and that's a strong body of research backing chiropractic care for all three, but patients walk in for all kinds of reasons. Sciatica, shoulder tension, hip stiffness, and even things like poor sleep or low energy. The reason the benefits can be so broad comes back to the nervous system. When your spine is functioning well and the nervous system is communicating clearly, your body just works better. When you move better, you recover faster, you feel overall better. Chiropractic isn't masking symptoms with medication. It's going to the root of the problem, letting your body heal how it should. So I want to address something I hear pretty often, and it's the question of how safe is chiropractic care. And when working with a licensed trained professional, chiropractors go through a really rigorous doctoral program, taking 4 years of graduate level education covering everything from anatomy and neurology to diagnosis, radiology, and extensive hands on clinical training. It's a serious degree for a serious profession, and adverse events from chiropractic care are genuinely rare, and most patients either feel relief right after the adjustment or within a day or two. So, what to expect with a chiro visit? If you've never been to a chiropractor before, the first visit usually looks like you sit down with a chiropractor, you talk through your health history, what's been bothering you, how long it's been going on, and then comes the examination where they test posture, range of motion, some orthopedic and neurological testing, and from there, your chiropractor puts together a care plan that's built specifically around you. And that's important because no two people walk in the same body or have the same situation, and healthcare should reflect that. So the bottom line is chiropractic is a natural, safe, and research-supported approach to healthcare, and it's a lot more about you than just your back, as a lot of people think. It's about making sure your spine and nervous system are functioning the way it's supposed to, so your body can perform and heal at its best. If anything I said today resonated with you, whether you're dealing with pain, stiffness, or just know that something feels off, I encourage you to take the next step and schedule a consultation with the chiropractor. You might be surprised at what's possible and how much your body is truly capable of. Thank you for watching. I'm Keegan Allen, Doctor of Chiropractic student.